So good afternoon, everyone.
Good afternoon, sir.
So last class we were discussing postural drainage, general consideration, all these things we discussed, and we were discussing things to remember before postural drainage, during and after. I think I had completed before postural drainage. So these are the points we discussed about the treatment, breathing pattern, cooperation, bronchodilator, all these things we discussed. So now we will be discuss. I think even these things, postural drainage position is also discussed by Madam Kruti Madam. She had taught, I think. So now we will discuss second point. That is during postural drainage. Things to remember during postural drainage. That is before, during, and after. We discussed 3 points. So first we already discussed. Second point we will discuss. What are the things to be remembered when the postural drainage is given? At the time of postural drainage, what are the things to be remembered? So first is during after positioning the patient, that is respective position depends on the lobe, the lobes which you want to drain. After making position, after making position, you will do some chest manipulations. You will do certain chest manipulation. In certain books, you will study chest physiotherapy. Clear? Chest manipulations like vibrations, clapping, and shaking. You will perform either one or all the three. It depends on the requirement. After positioning, after positioning the patient, see, suppose secretions are thin. You know the secretions are there are two types of secretions. Thin secretions. If the secretions are thin, then mere positioning will drain the secretions. Again, I'll repeat. If the secretions are thin, simply by positioning, suppose if this is the area you want to treat, this is your area you want to drain. If the secretion is thin, then automatically the position, gravity assisted position, will drain the secretion and bring to the main bronchus. Clear? Will drain the secretion to the main bronchus. This is applicable only when the secretion is thin. If the secretions are adherent, if the secretions are adherent, adherence means sticking, sticking within in the inner side of the lungs. If the secretions are thick, or if the secretions are adherence, or if the secretions are sticking, then simply the positioning will not drain the secretion because it is sticking. It is sticking to the lung. So what is required? In this situation or in this condition, you have to do certain manipulations to loosen the secretion. To loosen the secretion, first you have to do certain manipulations. So without this manipulation, or without the vibration, clapping, and shaking, it is difficult to drain the secretions. Or so again I'll repeat, if the secretions are thin, then these manipulations are not required. If the secretions are adherent, then you have to perform the manipulations in order to loosen the secretion. Clear? So what are the manipulations? So what are the manipulations? There are three types of manipulations. That is vibration, clapping, and shaking. So the tapotement massage are performed in a postural position. Clear? So this is called, if you in massage you would have studied, it is called as a tapotement massage. That is vibration, clapping, shaking. They are tapotement. They are called as a tapotement massage. So these massages are, or these techniques, or these manipulations are performed in postural drainage position. First, you have to position the patient in the appropriate position. Then you will perform these manipulations. And second point is, these manipulations should be performed in an order. Not order, it is a sequence. It should be performed in a sequence. Clear? That is vibrations, clapping, and shaking. It should be performed in a sequence. What is the sequence? What is the order? Vibration and clapping should be performed first, and shaking should be performed last. Clear? So this is the sequence. You have to follow this sequence. Clear? I'll tell why this sequence should be followed the later part of the lecture. First vibration, next clapping, and third is shaking. So first, what is vibration? So again, I saw last class, madam taught you practically how to perform vibrations. So palmar aspect of the hand are in full contact with the patient. You have to place the whole of the palm on the chest wall, and one hand may be partially or fully overlapping the other. Either you can do it with one single hand, or you can overlap the both the hand. Clear? Elbow should be in extended position. Elbow should be in extended position when you are performing vibration. So now, how you will perform? This is placement. This is placement of the hand. So at the end of deep inspiration, that is, at the end of deep inspiration, patient exerts pressure on the patient's chest wall at the end of deep inspiration. The question is, how you will know the patient is in the inspiration phase or expiration phase? I'll repeat the question. See, the vibration should be, see, certain manipulations. Okay. Vibration. mm, Vibration, clapping, and shaking. So these are the three manipulations normally used in chest physical therapy. So vibration should be performed. See here, at the end of deep inspiration, therapist exerts pressure on the patient's chest wall and oscillates the through the end of expiration. Through the end of expiration. So what does it mean? At the end of inspiration, therapist exerts pressure on the patient's chest wall and gently oscillate it through the end of expiration. So what is the meaning? The end of expiration from the class here, Roman. Okay. Okay. So at the end of, so what does it mean? Vibration should be performed during expiration, during expiration phase. Clapping. Now, when you see the clapping, uh, clapping can be performed during both inspiration and expiration phase. Even vibration can also perform. Even vibration can also performed during both inspiration and expiration phase. But shaking should be performed only during expiratory phase. Listen carefully. Vibration is the manipulation which can be performed throughout breathing. That is, throughout breathing means both in inspiration phase and expiration phase, you can perform this manipulation. Clapping also you can perform throughout the breathing phase. Clear? But shaking is the manipulation you will perform only during expiratory phase, not during inspiration. Clear? So the question is how you will know that patient is in inspiratory phase or expiratory phase. I think you understand my question. Deep.
Yes, sir.
So I have told three manipulations: vibration, clapping, and shaking. So you position the patient. That is, suppose you want to treat. Suppose you want to treat the. I'll take simple position. Okay. Lower lobe apical segment. Clear. So now you are doing the manipulations on the chest. Clear. This particular area you are doing the chest manipulations. So what are the manipulations? I have told three manipulations. One is, first is, what is the order? What is the sequence? Vibration, second clapping, and third is shaking. So first you will do vibration. Clear? With the extended elbow. Clear? The procedure I think madam she taught you. Okay, I don't want to go deep here. Vibration you will perform on the chest wall both during inspiration and expiration. Clear? Both during inspiratory phase and expiratory phase. That is at any time. At any time during the phase of breathing, you can do what? Vibration. And clapping also you can perform. Clapping also you can perform anytime during inspiratory and expiratory phase. But shaking you will perform only during expiratory phase. Question is what? Why? What is the reason? Who can tell? Yes? Anyone? So I am asking now two questions. Why shaking should not perform during inspiratory phase? This is first question. And second question is how you will know, how you will know patient is in inspiratory or expiratory phase. How you will know patient is inspiring or expiring? Anyone? Who can answer in any question? This question, anyone? Why shaking should not be performed during inspiratory phase? Deep.
Yes, sir.
So shaking should be performed during inspiratory phase or expiratory phase?
So it is performed during expiratory phase.
Why it should not be performed during inspiratory phase? First of all,
So
what is shaking? What is shaking? Shaking is the manipulation which brings the dislodged mucus towards the central airway. If you understand this point, then it will be easy. You will answer the question. Shaking is the manipulation. Again, I'll repeat. Shaking is the manipulation which brings the secretion or mucus towards central airway. See, suppose, imagine this is the lung and here is the secretions. Clear? So when you are doing shaking manipulation, it brings the mucus to the central airway. This area is called as, this is called central airway. So mucus is shaking, shaking, it brings the mucus to the central airway. Clear? Suppose if the patient, okay, what is vibration and clapping? Vibration and clapping, it loosens the secretions. It loosens the vibration and clapping, it loosens the secretion. Shaking, it mobilizes the secretion. Clear? So this is the use of the manipulator. That is vibration and clapping. It loosens. Suppose if the secretions are adhering to the lung, then it loosens. But shaking, it moves. It mobilizes towards the central airway. Suppose if the patient is inspiring and you are doing shaking, clear, during inspiratory phase, if you are performing shaking, then what will happen? The mucus will move to the periphery. Clear? So the mucus will move here. Normally it should move. Clear? Are you clear what I am saying?
yes, sir.
So this is expiratory phase. Expiratory phase. During expiratory phase, if you mobilize or if you do the shaking manipulation, then the secretions will move towards the central airway. Suppose if you are doing shaking during which phase? Inspiratory phase. Then what will happen? This is inspiratory phase. And if you are doing shaking, then this will dislodge to the, that is, it will move more periphery. Instead of moving central, this is called central airway and this is called peripheral airway. So that is the purpose you give shaking during expiratory phase. Are you clear what I am saying?
Yes, sir.
But vibration and clapping, there is no such restriction. Vibration vibration and clapping, you can perform either during inspiration phase or during expiration phase. Where is that question? I had asked you two questions. Mm, Okay. Hmm. So vibration and clapping can be performed both during inspiratory and expiratory phase, but shaking should be performed only during expiratory phase. This is my first question. What is second question? How you will know? Second is how you will know patient is in expiratory phase. What is the answer here? Anyone?
Sir, by chest expansion. Sir, chest expansion.
Chest expansion. Okay. So you will in the before starting the that is before postural drainage. What instruction you had given? Explain breathing pattern. है ना? We discussed before postural drainage. You will teach proper breathing pattern. So what is breathing? What instruction you will give here? You will you will give instruction to the patient to take inspiration through nose and expiration through mouth with whistling sound. This is the instruction you will give here in other instructions. That is, take inspiration through nose during postural drainage. Here, patient should take inspiration through nose and expiration through mouth with whistling sound. What does it? Or with pursed lip. With pursed lip, patient has to exhale slowly, or with whistling sound, he should exhale through mouth slowly. See, for example, ask the patient to see, take inspiration through nose and exhalation through mouth. Clear? With whistling sound. With whistling sound, patient is now exhaling. When the patient is exhaling through whistling sound, or when the sound ceases or when the sound disappears, what does it mean? That is, it is end of expiration. Are you clear what I am saying?
Yes, sir.
Yes,
So,
sir.
if the patient is exhaling through mouth with whistling sound, at the end of whistling sound, it represents or it denotes that patient is completing his expiratory phase and the inspiration is going to begin. Clear? So when you will perform the shaking, you will perform the shaking manipulation when you hear the whistling sound. Are you clear what I am saying?
Yes, sir.
So this is how you can identify. Here I had asked this question. Why shaking should not be performed during inspiratory phase? Shaking should not be performed during inspiratory phase because the secretion will mobilize peripherally. Instead of mobilizing the secretion centrally, the secretions will move more peripherally. More peripherally, the secretions will move if you perform shaking during inspiratory phase. Because what is the purpose of shaking? The purpose of shaking is to mobilize the secretion. So the secretions will move periphery instead of central. That is why you should not give during inspiratory phase. Second question. How you will know the patient is in inspiratory phase or expiratory phase? So for this, you had already given instruction that the patient should always expire through whistling sound. So you will hear the whistling sound during expiratory phase. So you will perform the shaking mobilization when you hear the whistling sound. If you are performing shaking when you are not hearing whistling sound, it means you are performing shaking during inspiratory phase and it will move further inside or further periphery. Are you clear?
Yes, sir.
Now you read this point. At the end of deep inspiration, at the end of deep inspiration, the therapist, that is after taking deep inspiration, now the therapist is exerting, sorry, this is vibration. Okay. Shaking. See, shaking should be performed only during expiratory phase. Anterior and posterior chest wall is grasped and shake towards the main bronchus. Anterior chest wall and posterior chest wall is grasped and you will shake towards the main bronchus. Suppose imagine patient is lying in the side lying position. Imagine patient is lying in this side lying position. So you will grasp the anterior chest wall and posterior chest wall and it should be shaked in this direction. Shaking should be performed towards main bronchus. So there is main bronchus. Main bronchus is somewhere here. This is main bronchus. So you have to perform the shaking towards this direction. Shaking, grasp the anterior chest wall and posterior chest wall and shake. Shake the chest towards the central bronchus or the central airway. Towards the main bronchus. Clear? And this should be combined with relaxed breathing. After performing one or two shaking, instruct the patient to go for relaxed breathing to prevent bronchospasm. Because during shaking, there is a possibility of bronchospasm. The bronchus may go develop spasm and patient may have breathlessness during shaking. So what you should do after performing one or two shaking, you ask the patient to breathe relaxed, that is diaphragmatic breathing, relaxed breathing. This will prevent the bronchospasm, aggravation of bronchospasm. So this is about the shaking. And what is clapping? Clapping should be can be performed. Clapping can be performed during both inspiration and expiratory phase. Here, and it also can be performed with a mechanical device. There are certain devices which will clap, which will do this, substitute this manipulation. And procedure, you know the clapping. In second year already you discussed, you already practiced. Cupped hand. With a cupped hand, you will rhythmically clap the chest wall. So thin clothing should be applied here in order to prevent unnecessary sensory stimulation. Tactile stimulation को prevent करने के लिए और to prevent tactile sensation, you will use thin clothing. And what is the principle? What is the principle? What is the principle? behind the clapping, it is compression and rarefaction. Clear? Compression and rarefaction is the principle behind the percussion or behind the clapping. And this rhythm should be between 100 to 480 times per second. Clear? This is the speed of the clapping, rate of the clapping. Clear? So amount of force should be adjusted according to the patient comfort, because the patient will have pain. The patient will have chest pain. Clear? The intensity of the clapping should be accordingly. It should be according to the severity of the patient. Clear? And you should avoid clapping in the bony prominences and surgical incisions. Clear? And precautions. Clapping will develop bronchospasm. Like shaking, clapping will also develop the bronchospasm. And in osteoporosis, it is contraindicated. Osteoporosis, the bone will be weak, the rib cage will be weak. And if you give clapping, then what will happen? There may be possibility of rib fracture. Clear? There may be possibility of the rib fracture during clapping. So in osteoporosis, either it is contraindicated or you should modify the treatment, or the intensity of the clapping should be reduced. In rib fracture, yes, already it is strictly contraindicated. You cannot perform the clapping in fractured rib, and if there is any tumor or obstructions in the airway. So this is about clapping. And vibrations we already discussed. Vibrations, yes, it also can be performed both during inspiratory phase and expiratory phase. And percussion also can be performed during inspiration and expiration. And these are some relative contraindications. Okay. And shaking should be performed only during expiratory phase. Any doubt? Any doubt?
No, sir.
So after we will discuss next class. I think it's enough. So we have studied uh, two. That is 1 second. Hmm. Things to remember before postural
I have
drainage,
taken the attendance.
and during postural drainage. We have completed these two topics, and this topic we will discuss next class. If you have any doubt, you can ask me. Any doubt?